everybody, welcome back again to the channel. It's still me and Ski. We had a video last week where we talked about the steps to being a registered nurse, and this week last week you mentioned something like nursing jurisprudence, which is where I feel some of us may have issues where we're trying to like get the whole license process over with, because scope of practice differs from state to state in Canada, and it also differs from country to country. So I think it would be better if she just tells us some of the things that are within jurisdiction or within the scope of practice of nursing, both RPN and LPN as well as RN, so we can at least have like a background knowledge before going for whatever exam it is. So that's key. I'm going to be asking you some questions and you just tell me if we can or cannot. Okay, so in Ontario, Canada, which is where you work, and Quebec,
yeah. I was actually Quebec. Yeah, that's where I used to work for a little while too, but I'm mainly in Ontario now.
Okay, so in Ontario, do nurses set IV lines?
Yes, from start to finish. Where the difference comes in between RNs and RPNs, which for those of you who don't know, an RPN is a 2 to 2.5 year program. Sometimes you'll see them in the US, it's 1 year. In Canada, it's 2 years. You won't see anything less than 18 months, but it's usually about 22 to about 26 months. And the RN program could be either 3 or 4 years. That's the main difference. But when it comes to setting IV lines, yes, we do it from start to finish. We enter the vein, we hang the bag, we set the pump, every single thing. The only difference between the RPN and the RN is what is in the bag. So RPNs may have some limitations on what they can administer.
Like what?
Like in Ontario, certain places won't allow you to administer IV iron.
Okay.
You can set the pump, you can stop the pump, you can start the line, enter the vein, set everything up for the RN, and she will come hang the bag and program the pump. If you see your patient having a reaction to the iron, you can stop it, but you can't actually hang the bag. But we can give IV antibiotics, certain medications, IV fluids, and stuff like that.
Before we go on, there's a question I wanted to ask, because I'm getting questions from people on Instagram asking if it's possible for people who were not initially science students to become nurses. Now, is there like a level of nursing that they have access to?
Yes. So for RPNs, there isn't a large amount of requirements or prerequisites that you need. You just need a high school diploma, like to finish your high school diploma, and you need a certain grade in your maths and your sciences. Certain schools will require for you to have at least a minimum of 80% in physical science or biology. Whereas for RN, you need your grade 12 chemistry, biology, English, and math, and you'll need to have a certain grade in those stuff too.
Okay, so it's possible if you were not really a major science though I think they will have to do more research on that, but the fact that there is a possibility is established. Okay, Naski, do you guys put up blood in Ontario?
Yes. And I think in almost every province, registered nurses definitely hang blood. For registered practical or licensed vocational nurses, they can all be used interchangeably. They all mean the same thing. In Canada, you'll hear LPN or RPN. In the US, you'll hear LVN or LPN. We don't actually hang the blood. We can co-sign with a registered nurse.
What does it mean to co-sign?
So when you're hanging blood, you have to make sure that you're giving the person the right type of blood. If not, there could be all types of complications. So usually for certain medications, which blood is considered to be a medication, a very high risk medication, you need 2 nurses to sign off on that medication, making sure that the blood type is the right type of blood. that for the patient. You don't want to give the wrong type of blood to a patient. So the RPN can look at the blood with the RN and sign off saying that, okay, both of us agree that this is the right type of blood for this patient. The RN can actually hang and run the bag. RPNs don't run the bag. We can only co-sign, but registered nurses do it.
All right. What about chest tubes?
RNs only. We don't do chest tubes. RPNs don't do chest. RNs do chest tubes.
Okay, what about, let's say, resuscitation? Who does that? Is it
Orderlies can do resuscitation. Janitors can do resuscitation. In most healthcare facilities, everybody in the facility, even the laundry people, are trained to do resuscitation.
Wow.
Because a resident can be walking around, a patient can be walking around. You know, in our hospitals, you'll see patients going out to smoke a cigarette. Like, they'll be there with their IV poles, taking a walk, which we actually encourage them to do. You don't want your patient to just lay on the bed. Mobility is very important for blood circulation, bowel movement. So you'll see them walking around a lot, and somebody might just drop in front of you. You need to know what to do. So everybody in the facility will be trained to do resuscitation.
So it doesn't even matter if you're a doctor, a nurse.
It doesn't.
Everybody has to do resuscitation.
Everybody has to be first aid and BLCS trained to work in a facility.
BLCS. I think that's what we call BLS. Yeah, basic life support.
So everybody is trained. So the orderlies or the janitors or whatever will do it until registered staff comes and takes over.
Okay. So wait, the thing is that here in Nigeria, right, there are things we call maybe doctor's procedure, nurse's procedure, meaning possibly the hospital says doctors can do this, nurses can't. For example, in most teaching hospitals here in Nigeria, nurses don't set lines. So now I asked, I think that was the first thing I asked, if you guys set lines. You clearly said both RPNs and RNs can set lines. So what exactly do your doctors, like, what do they do?
So the doctors, the main thing that they're really there for is prescription and assessing. The nurses will also do an assessment, but there's a limit to the assessing, right? Even if we assess something and we see something that's abnormal, we still need to call the doctor to come make their own assessment and determine what it is that's going to be done about the issue that we're observing. So they're the ones who are going to do the assessing, the research, and the prescribing. And we are more the hands of the facility.
Wow. That means, I think the relevance is clearly spelled out for nurses over there.
Yeah,
that's actually lovely. What about catheterization? Who does that?
RPNs, RNs do catheterization.
RPNs, RNs do catheterization. Wow. What about passing NG tubes? Who does that?
RPNs and RNs
do NG tubes, but the doctors prescribe. What about taking blood samples?
RPNs and RNs.
You guys do a lot. Well, like I'm actually. All right, now we've talked about so many things that you guys do that I've asked. Like, what are the other things that you guys do? Like, do you guys do the wound care?
Yes, we do wound care. Even we have like special wounds called. I don't know if you guys have ever seen VAX.
That's vacuum something. Yeah, vacuum dressing.
Yeah, exactly.
Yes, I've seen
so
that.
We do advanced dressings or just basic dressings, wound care. You'll see us do. Tube feedings, and I'm talking about nasal ones, the ones that go from your nose down into your stomach, NG tube, or the oral tubes that go from your mouth into your stomach, which is usually done by an RN.
Okay, so the NG tube is done by
the RPN or the
RN, but the oral tube is done by
the RN in most cases.
Okay.
But it may vary depending on what province.
What about the ones that go directly into the
stomach?
Yes.
So tube feedings are done by us, and the pump is programmed like an IV pump.
Yeah, you guys program your pumps.
Yeah, we program our pumps.
Well, that's nice. So what else do you do?
We do urine tests, urine samples. What else do we do?
What about vitals? Who does the vitals?
We do the vitals. Both the RNs and the RPNs do their own vitals. So you're assigned your own patients, and you will do the vitals for all of your patients.
Wow. So, like, what's the patient to nurse ratio?
Usually on a it varies depending on the type of unit that you're on. In a unit like an ICU unit, which is usually where RNs work, it's very rare that you'll see an RPN in an ICU, in an intensive care unit, unless it's an extremely seasoned nurse that's been, an RPN for years. In an environment like that, you might see two. Okay. Anything over 2 is considered overload.
Wait, a nurse to two patients
in an ICU unit.
Wow. That's lovely.
In a med-surg unit, like on a medical surgical unit, which is where I worked when I was in the hospital, you could see anywhere from 4 to 9 patients. There were times where I had 4
patients per nurse.
Per nurse.
Isn't that too much?
It is a lot. 9 patients is a lot, but a lot of the times when you have 9 patients, it's usually night shift. A lot of nurses will call off during the night, so you'll end up having to take on their patients, which is a lot. But usually 4 or 5 patients is
4 or 5 patients.
4 or 5
That's
patients.
norm.
Yeah.
Okay.
In a long-term care residence, though, geriatric unit, I am the only nurse on the unit, so I'm the one doing the wound care and the medication for the entire unit, which is usually, I think my unit has about 27 people.
27 people
To me only.
So I think it's not only in Nigeria that we're short staffed. I think it's generally everywhere.
But the thing is, from what you were explaining to me, on your ward, your ward is a little bit more like a med-surg ward because you have, people coming in with different issues that need to be treated. Whereas in a long-term care facility, your residents are stable. They're not sick.
Oh, okay.
You're just there to maintain their health, to make sure that they get their medication. So they're receiving the same medications every day, and they're there until they die. So the routine is the same every single day.
So it's not really, you don't really have to do so much vigorous.
Yeah, exactly.
activities.
It's not really much that you're doing. You just mainly give your medications. Sometimes somebody may fall. You'll assess them and determine if you want to send them to hospital or not.
Okay.
That's pretty much it.
Well, I think we've heard so much from Naski, but in the first video, if you didn't watch the first video, I'll leave the link here or down in the description so you can click to watch that once you are done with this. So it has been a very nice time with you, Naski. You've really enlightened us on a lot of things, and we're so grateful to have you here.
Thank you for having me.
I hope in the future we'll still get to do other videos. Alright guys, so guys, don't forget to give this video a like, leave a comment, share to your friends, and subscribe if you've not joined the family. I'll see you in the next video. Bye.
Bye.